Welcome to Elements, your daily source of insights across finance, science, and beyond. Whether you're traveling, taking a lunchtime stroll, or simply relaxing at home, we're committed to providing new content every day, so join us to grow and learn while living your busy life. Today, we're going to talk about high blood pressure, a common health condition that often goes unnoticed but can have serious consequences if left unmanaged. What is high blood pressure? High blood pressure, also known as hypertension, is a condition where the force of blood pushing against the walls of your arteries is consistently too high. Arteries are the vessels that carry blood from your heart to the rest of your body. When the pressure is too high, it puts extra strain on your heart and blood vessels, which can lead to health problems like heart disease, stroke, and kidney damage. The history of high blood pressure. The understanding of high blood pressure has evolved over centuries. Ancient physicians like Hippocrates recognized the importance of the pulse, but it wasn't until the 18th century that accurate blood pressure measurement became possible. In 1733, English clergyman Stephen Hales made the first recorded measurement of blood pressure in a horse by inserting a tube into an artery and observing how high the blood rose. This was a significant step towards understanding circulation. In the late 19th century, the invention of the sphygmomanometer allowed for non-invasive measurement of blood pressure in humans. Later, in 1905, Russian physician Nikolai Korotkov refined the technique by introducing the method of using a stethoscope to listen to arterial sounds, which is still used today. Throughout the 20th century, research established the link between high blood pressure and cardiovascular diseases. In the 1950s, large-scale studies like the Framingham Heart Study in the United States provided valuable data on the risks associated with hypertension. This led to the development of guidelines for diagnosis and treatment, improving patient outcomes worldwide. What causes high blood pressure? High blood pressure can be caused by a variety of factors, often acting together. Lifestyle choices play a significant role. For example, consuming too much salt can increase blood pressure because it causes the body to retain water, putting extra pressure on blood vessels. Lack of physical activity can also contribute, as regular exercise helps keep the heart and blood vessels healthy. Other factors include being overweight, excessive alcohol consumption, smoking, and stress. Genetics can influence your risk too. If high blood pressure runs in your family, you may be more likely to develop it. Certain medical conditions, such as kidney disease or hormonal disorders, can cause secondary hypertension. For instance, someone with an underactive thyroid gland may experience increased blood pressure due to changes in hormone levels. How can I know if I have high blood pressure? Since high blood pressure usually doesn't cause symptoms, the only way to know if you have it is to get it measured. This can be done at your doctor's surgery, some pharmacies, or even at home with a reliable blood pressure monitor. Regular checks are important, especially if you have risk factors. For example, John, a 45-year-old office worker, felt fine but decided to have a routine health check. His doctor found that his blood pressure was higher than normal. Without this check, John wouldn't have known he needed to make lifestyle changes and possibly start medication to reduce his risk of future health problems. What can I do to lower my blood pressure? Lowering high blood pressure often involves making lifestyle changes. Eating a healthy diet rich in fruits, vegetables, whole grains, and lean proteins can help. Reducing salt intake is particularly important. Adults should aim for less than 6 grams of salt per day. Regular physical activity, such as brisk walking for 30 minutes most days, can make a significant difference. Maintaining a healthy weight is also beneficial. Limiting alcohol consumption, quitting smoking, and managing stress through techniques like meditation or yoga can also help. In some cases, doctors may prescribe medication to help lower blood pressure. It's important to follow medical advice and take medications as directed. What are the risks if high blood pressure is left untreated? If high blood pressure is not managed, it can lead to serious health complications. the heart has to work harder to pump blood, which can cause it to enlarge and weaken over time, leading to heart failure. The risk of heart attacks increases because hypertension can contribute to the buildup of plaque in arteries. Stroke is another significant risk. High blood pressure can weaken or damage blood vessels in the brain, leading to a rupture or blockage. Kidney damage can occur as the blood vessels in the kidneys are sensitive to increased pressure, potentially leading to kidney failure. High blood pressure affects over 1 billion people worldwide. High blood pressure is one of the most prevalent health conditions globally. According to the World Health Organization, an estimated 1.13 billion people have hypertension, and this number is rising. It's more common in low and middle-income countries due to factors like increasing urbanization, unhealthy diets, lack of physical activity, and limited access to health care. This widespread prevalence makes hypertension a significant public health concern, contributing to the global burden of cardiovascular diseases. Efforts such as public awareness campaigns, improving access to medical care, and promoting healthier lifestyles are essential to address this growing issue. Children and teenagers can have high blood pressure too. While high blood pressure is often associated with adults, it can also affect children and adolescents. Factors such as obesity, poor diet, lack of exercise, and genetic predisposition contribute to hypertension in younger populations. With the rise in childhood obesity rates, more children are being diagnosed with high blood pressure at earlier ages. This is concerning because early onset hypertension can lead to long-term health problems like heart disease and kidney damage. Regular health checkups, encouraging active play, and teaching healthy eating habits are crucial steps in preventing and managing high blood pressure among children. Schools and parents play a vital role in fostering these healthy behaviors. High blood pressure is often called the silent killer. Hypertension is frequently referred to as the silent killer because it typically has no obvious symptoms until significant damage has occurred. Many people with high blood pressure feel perfectly fine and are unaware of their condition. This lack of symptoms means that hypertension can go undetected for years, increasing the risk of serious health issues like heart attack, stroke, and kidney failure. Regular blood pressure checks are essential, especially for adults over the age of 40 or those with risk factors such as a family history of hypertension. Early detection allows for timely intervention and reduces the likelihood of complications. High blood pressure is a common but serious condition that can have significant health implications if left unchecked. The good news is that with regular monitoring and lifestyle changes, it can often be managed effectively. Whether it's through a balanced diet, regular exercise, or following medical advice, taking steps to control your blood pressure can lead to a healthier life. What are your thoughts on high blood pressure? Do you have experiences or tips you'd like to share? Share your thoughts in the comments. Thanks for being here. If you find this helpful, consider subscribing. More content is on the way, and I hope to see you again.